How to treat first aid kit on sprains. Even if you do not lead an active lifestyle, you might sprain a joint at any point in time. As the ankle is the most commonly sprained joint of the body, let's look at how to render basic first aid to it. Treatment of sprains is simple. All you need to remember is a simple bowl of rice. Why rice? It's because it stands for rest, ice, compression, and elevate. Rest the joint if you are in the middle of a workout. Stop putting pressure on the affected area. If you choose to ignore the sprain, you will risk permanent damage. Ice the affected area. Do this as soon as possible to help limit the swelling after an injury. Remember, do not apply ice directly onto your skin and try to wrap it with a towel. Compress the affected area. A crepe bandage from your first aid kit will work very well for this. Elevate the joint. If possible, try to raise the affected area above your heart. This helps to prevent and limit swelling. This process can be done 4 to 8 times a day and up to 2 days after the injury. Do also note that you should only ice the sprained area for up to 20 minutes at a time. Get medical assistance if you experience any of the following. Develop redness or red streaks that spread out of the injured area, or if the area has been injured for several times before. First aid for strain. In this case of a broken bone, call the emergency services and don't move the injured person. Keep the injured area and still and supported. In the case of a broken bone, call the emergency services and don't move the injured person unless absolutely necessary. Keep the injured area still and supported. Don't try to manipulate or realign the bone. To elevate the pain and swelling, apply ice, wrapping the cloth without moving the affected. Don't place the ice directly on the skin. Keep the victim calm and in a comfortable position until help arrives. If you find yourself in the right place at the right time, be prepared to save a life. And follow the steps. Call emergency services. Don't move injured area. Apply ice packs. Keep. How to treat bumps and bruises. First aid. After an injury, it is common for somebody to get a bump or a bruise. Bumps and bruises may not appear straight away, but the skin can still feel painful, swollen, and tender. Bumps are swellings under the surface of the skin caused by fluid, and bruises are purple or bluish patches caused by tiny blood vessels that burst into the soft tissue. Bruises usually change to a greenish or yellowish color as they heal. To treat a bump or a bruise, you need to apply something cold to the skin. This will reduce the pain and help it to heal if you haven't got an ice pack. You could use frozen peas or ice wrapped in a cloth, but remember, don't leave it on for any longer than 10 minutes. If the bump or bruises is very painful, then ask the casualty to lie down and raise the injury above the level of their heart. This will reduce the swelling if the bump or bruise becomes very painful or very swollen. Then seek medical advice or go to the hospital.
So that should be all. Thank you.